started the recording.
This is started, right?
Yeah.
Yes. You want to set record on this computer?
Yes. In the little in the corner, it says recorded.
Ah.
Yeah. I think we're fine. I've done that in the last 6 times, right?
The panic.
I'm still panicked, yeah. Okay, I don't see anything.
Gosh. I don't like this. Maybe.
Yeah.
I hope people in.
Should people in?
Also.
Should I let people know?
Yeah.
Okay, now the Spanish and the Famos. Did you get the message? No. I'm writing. Is there something that we can?
He does not respond. I can do until the chat moderator, and I can introduce Hamed. Do I have Hamed? Yeah, then we just start and see how it goes.
Okay, morning, we're on the right? I admit all everything. I admit all the names. Adrian, join.
Good morning, good afternoon, everyone. Thank you for joining. We would like to welcome you to this very last webinar in a series of 4, trying to find answers to 2 essential questions when it comes to our MHPSS services. And they are we doing the right things, and are we doing them right? Now, in the other 3 webinars, we spoke about the importance of culturally adapt our tools and methods of contextualizing them. We talked about assessments and about monitoring and evaluation. Today's webinar is dedicated to MHPSS Research. My name is Monja Ebersold. I'm a program manager and MHPSS focal point at the Swiss Red Cross. And I'm co-leading a working group under the roadmap together with Sarah Kate van der Walt from the ICRC PS Center, who is also here today. Before we start, we would like to inform you that we will record this webinar for later use. We would like to ask you to put on your cameras anyway, so that we know whom we're talking to. It's always nice to put faces to the names. This webinar is held in English, but with translations to French and Spanish. You'll find the translations in your language in the corresponding channel under the little world icon in the bar just below, in the globe icon. And we would also like to ask you to put your names, your organization, and your email address in the chat so that we can keep in touch, send you the resources that we would like to share after the webinars. Now, this webinar series is organized by the Priority Action Area 4 working group. I already mentioned this working group. It is committed to the implementation of the MHPSS roadmap. Now, not everyone present might be so familiar with this initiative. And for this reason, we would like to start with a short introduction video on the MHPSS resolution policy and the roadmap, just to give you an idea of the context in which we are operating. There we go.
In the following presentation, we would like to give you a very brief and simplistic introduction to the mental health and psychosocial policy, resolution and roadmap working groups. As for you to understand the connection with today's webinar and the MHPSS roadmap within the Red Cross and Red Crescent movement. Every day, the Red Cross and Red Crescent movement around the world is confronted with the extensive unmet mental health and psychosocial needs. The movement saw an urgent need to increase efforts to address these needs, and therefore, in December 2019, the movement made historical commitments and adopted a joint movement policy on mental health and psychosocial needs in all contexts. Also, together with 196 states, the state parties to the Geneva Conventions, the ICRC movement recognized the urgent need to scale up the collective response to the MHPSS needs of people affected by armed conflicts, natural disasters, and other emergencies. Turning our attention back to the MHPSS policy, its aim was also to contribute to an enhanced RCRC movement response by providing overall guidance to national societies, the IFRC and the ICRC on how to build a more harmonized, integrated, contextually appropriate and holistic response to MHPSS. With the policy, a roadmap document followed, highlighting 6 priority action areas on addressing mental health and psychosocial needs. The roadmap sets out a strategic and coordinated approach in terms of the activities to be carried out individually by national societies, the IFRC and the ICRC, and activities to be carried out together. The ICRC and the IFRC and a group of national societies have supported and coordinated the rollout of the roadmap since 2020 by, for example, creating 5 working groups. These groups were officially formed based on the priority action area thematics. Working Group 1. Achieve a basic level of MHPSS across sectors. Working Group 2. Reinforce the movement's MHPSS collaboration. Working Group 3. Promote the MHPSS well-being of staff and volunteers. Working Group 4. Demonstrate the impact of MHPSS interventions. Working Group 5. Strengthen the advocacy for mental health and resource mobilization. For this webinar series, a number of national societies engaged in Working Group 4 have come together to showcase good practices from national societies and to highlight various aspects of monitoring and evaluation and research. The working groups are a unique space for various RCRC movement actors to exchange experiences and work jointly toward the implementation of the MHPSS commitments. The working groups continue to rely on the participation of national societies. For these groups to remain relevant, it is necessary that the participants from national societies represent all regions and all levels of MHPSS experience. Come and join the working group efforts to ensure your region's voice and experiences are being heard and represented in 2023 and beyond. Thank you for listening and enjoy the remaining of the webinar.
As we've heard, the aim of our working group number 4 is to strengthen the evidence of our MHPSS services, as this helps us to improve not only the efficiency, but also the effectiveness of MHPSS, and thus allows us to reach more vulnerable people with appropriate mental health and psychosocial support. Now, I would like to hand over to the host of this webinar, Adrian Reed. Adrian is the Youth Director and Cash Voucher Assistance in the Emergency Focal Point at the Jamaican Red Cross He's also in charge for all Red Cross youth clubs across Jamaica, and he's a principal for a school for youth at risk operated by the Jamaican Red Cross. Thank you for leading us through this series of webinars. I hand over to you, Adrian. Welcome.
All right, thank you very much, Monia. Good day, everyone. All right, so as Monia mentioned before, we are here for the fourth webinar in our series. For those who are just joining us, please place your name, the country or organization you represent, and your email addresses in the chat. Translations are available in the lower section of the screen. You can look for the globe icon, and then you can click on it and then choose your language of choice, which will then allow you to hear the presentations in your local language or the language of your choice. Throughout the presentations, if you have any questions, please place them in the chat and we will have them addressed at a later section in our program. And we will now be moving on to our very first presentations. Additionally, right throughout the webinar, we will also be sharing links to various resources in the chat, so you can click on those and make use of the information that is shared there. And I guarantee you it will be very useful information regarding our topic today. So our first presenter today is Dr. Hamed Seddighi, and he's a postdoctoral researcher at the University of Groningen, specializing in mental health of children and youth exposed to various stressful life events, including emergencies. With a strong background in clinical psychology and experimental psychopathology, he serves as the associate editor of Disaster Medicine and Public Health Preparedness Journal, the Cambridge publication, and has reviewed for various scientific journals. In addition to his academic work, Hamed has a decade of experience in executive positions within the Iranian Red Crescent Society, including Deputy for Youth, Deputy of Education, Research and Technology, and currently as the advisor in education and research. So you see, he's a very knowledgeable person that we have presenting to us today. Throughout his career, he has collaborated with international humanitarian organizations such as UNICEF, ICRC, and the Mental Health and Psychosocial Support Center of the ICRC. Hamed has also served as a dean for the Red Cross Applied Science University in Iran, Izad province, where he contributed to the development of 9 bachelor programs and increased the number of students. So without further ado, I hand over to Dr. Hamed. Hamed, the floor is yours.
Thank you so much, Adrian, for your warm introduction. And hello, everyone. Thank you so much for participating at this webinar. I want to present first presentation on research on MHPSS within the movement. And so now I'm sharing my presentation with you. I hope you can see that. So the topic that I want to talk about today is about social, cultural, and political considerations for conducting research on MHPSS in emergencies within the movement. I will talk about in different chapters on social, cultural, political considerations, and then I will tell some strategies for addressing these considerations on research. First of all, I want to talk that how much is important to consider these factors under research about MHPSS. So if you want to have an effective MHPSS intervention, you need some evidence-based research, and also you should consider social, cultural, and political context in your research, because these factors can influence on prevalency and can show that how much maybe different problems can happen for people. And if you want to research on MHPSS in an emergencies, it's not possible to exclude these factors from your research because it's a big system. So if you want to research on a big system, so Red Cross, Red Crescent societies are one factor in this big research, big system, and there are different other elements that you should consider them from that system. So it's a system thinking that you should consider all of elements of system in your research. And if you take into account these factors, different researchers and practitioners, especially researchers within the Red Crescent societies, can design better research for finding and for better monitoring and evaluation, and better research on MHPSS. The first element is social consideration. If you want to understand better the system of research, it's good to know that to understand the affected population. And if you want to know affected population, it's good to first know the demographics. So demographics will mean that age, gender, socioeconomic status, and other social determinants of health of people. For example, if you want to research, to design your research on a context, you should think about diversity of people, how age groups are children, elderly people, or for example, the other characteristics such as people with disabilities are in the society, and include them in your research. So the first thing you should know is demographics of the society that you want to research on that. And these demographic factors are very important on the research and also on the mental health needs of people. The second social factor is family and community dynamics. So family and community dynamics have a key roles and significant role in coping with and recovery in emergencies. If you want to design better interventions during emergencies, and before that you want to produce some evidence-based programming, it's good to know from before that and understand the dynamics of family and community system. In different countries, these dynamics are different. Even in one country, in different places, in different cultures, the community and family dynamics are different. So as a researcher, as someone that wants to design a research, a good research, at least for an evidence-based monitoring and evaluation for your program, it's good to aware about family and community dynamics. And another thing is pre-existing social issues. So emergencies, we know that exacerbate pre-existing social issues such as poverty, inequality, and marginalization. For example, if you want to research on child abuse and you want to know what is the prevalence of child abuse after an emergency, one of the things that you should know beforehand the research is knowledge about the prevalence of child abuse before a disaster, before the emergency. For example, when we want to design a research on child abuse in Iran after an earthquake in Kermanshah province, so we ask some researchers and also some local people that what is the prevalence of child abuse in this province, and then after that we designed our research, and we found the prevalence of child abuse in that province, and then we can compare the situation and better designing interventions for MHPSS for that province and for affected people. So pre-existing social issues is another social thing that you should consider during your research on MHPSS within the movement. The second element is cultural context. So cultural variation in mental health concepts is very important, and they have a very cultural norms. They have a very significant role in your research and also on interventions. Cultural belief and practices, for example, what is the culture of the context that you want to research on that? And what's their expectation? How many different cultural norms are in the context and in the region, for example, or in the province or in the local level? When you design or when you are designing your research, also you should think about culturally sensitive assessment tools. When you are designing your assessment tool, it's good to know that how much your tool is culturally sensitive. In addition, engaging with the stakeholders and resources is very important for your research. Collaboration is part of your culture, part of social and cultural and political considerations, collaborating with local partners. For example, community leaders, healthcare providers, and traditional healers. Because we are not alone in the scene of emergencies. We are one of the responders. We are one of the stakeholders that we are working at that situation. There are so many other actors and stakeholders that are working. And if you want to design a good research, and if you want to be successful in your research and then also interventions, one of the secrets is good collaboration with local partners. And it's not happening only during the emergencies. During emergencies, it happened before emergencies. You should make this bond, you should make this network before emergencies and use that during the situation. So if you are a researcher, if you want to lead some researchers to conduct some studies on MHPSS in the emergencies, you should have a good collaboration with local partners and to know that how much is their weight. For example, you should have, and it's good to have a list of stakeholders as a stakeholder analysis. So when you have your stakeholders, you know them and their weight. For example, some stakeholders, their weight is less, and some stakeholders, their weight is more than. For example, some stakeholders are in minority, but their weight is more than others. And some stakeholders, they are in majority, but their weight is not so much. So considering these elements and these factors in the design of your research will be very important and will help you to have a successful research on MHPSS within the movement. The other thing is integrating traditional and religious practices. We cannot ignore the religious system in the context, and we should include those practices in our study. The other thing is capacity building and sustainability. So if you want to have a good atmosphere and good system for research on MHPSS, building local capacity for MHPSS in emergencies can help and ensure the long-term sustainability and effectiveness of interventions, as well as promote cultural competency within the local response. It's not only about us. If you are working in the national society, it's good to work with universities, with institutions, with research, with other researchers, even they are not working with Red Cross Society, Red Cross and Red Crescent societies. We can invite them to and engage them in the process of defining the research, from the first step, formulating research questions, and then finding a good method for conducting our research, and then data collection and finding results and interpretation of data. So I think, so when you are doing that, even you will not work at that society even after that, you have a sustainable system for research, because universities and institutions worked before with your society, and after you also, they will continue their collaboration with the society. So capacity building is very important for research on MHPSS in the movement. And also political considerations is very important, because politics is very strong factor and can change the situation for your research. For example, political instability and conflict can change, and we should consider during our research emergency setting, particularly in conflicted area, may present political challenges and risks that can impact the planning, implementation, and evaluation of MHPSS studies. There will be some dilemmas, and it will be good to know before conducting research, when you design your research, to know about this political instability, or at least what's expectation of politicians from you. What will be the dynamics of collaboration with politicians on your research, and how you can collaborate with politicians, and how you can consider the situation in your community in your research. The other thing is ethical considerations. Researchers should consider the ethical implications of conducting MHPSS studies in political complex environments. So the first thing that we know in the movement that is do not harm. So we should try, and we should consider that when we conduct a research, we will not harm nobody, a participant. Especially our participants of research are more sensitive. They are more vulnerable people. Sometimes they are minorities in our country. Sometimes we are talking about sensitive content for research. And when we collect data about these groups, maybe they will be in danger, not that time, maybe in the future. So ethical considerations during the designing of our research is very vital. The third point is access to affected populations. Gaining access to people in emergency setting may require navigating political barriers. Always it's not possible to access to people, especially for freelancer researchers. Maybe sometimes it's impossible to go to the context, and sometimes because of securitization of the situation, it's not very easy to access to people. So if you want, as someone that's working on research within the movement, is knowledge about the political situation and how you want to lobby with the political leaders in the community and convince them that why this research is important and how can this research help to the situation of the community and the country, and it will be useful for them. This convince and this process is very important to convince these people, these political leaders and the political system, especially with different competitors. Maybe sometimes it's a very dynamic situation. So it's not, we are not talking only about one, for example, party. There are different parties of politicians in one country, and at the same time, we should have a good collaboration as national society, as a neutral maybe element in the country. We should have these communication channels with different groups of politics to convince them that why this research are important, or for example, evidence-based monitoring and evaluation is very important. So if I want to settle my recommendations, and at least key recommendations for researchers and practitioners, first is engage in cultural humility. Second one is foster community participation. So participatory method is very important in research. Third is navigating political complexities that can change the situation of your research on MHPSS. Fourth is promote multi-sectoral collaboration, collaborate with different stakeholders from various sectors and coordinate efforts to promote a comprehensive and effective response. If you are working in local level, working with different stakeholders at local level and at the same time in national level will be important. You shouldn't ignore, for example, okay, I'm working in the local level, I will talk only with the local stakeholders. Sometimes you need to talk with also the ministry, vice minister, or some other people in the capital, and gain more fund, gain more resources for your research, because the results of your research will be helpful for the national level and maybe sometimes global level. Thank you so much for your attention.
All right, great. Thank you very much, Hamed. Okay, so in the meantime, well, thank you very much for the presentation, Hamed. Do we have any questions, Monia, for him as yet? Oh, not as yet?
No questions so far, Adrian. Please, everyone, if there's any questions, don't hesitate to put them in the chat anytime. We'll pick them up later. Feel free.
All right. Okay, no problem. All right, so in that case, we will then move on to our second presenter for the day. Again, for those who are just joining us, welcome to part 4 of our 4-part webinar series, held monthly. This is a final one in the series. And so this one is focusing on research in MHPSS. For those who aren't familiar, MHPSS means mental health and psychosocial support. And so we encourage you, if you have any questions for our presenters or any questions relating to the topic at all, please place them in the chat and we will have them addressed as we go along. Additionally, pay attention to the chat as well. We will be sharing various links to resources in the chat that you can make use of that are also very important as it relates to research in MHPSS. Additionally, for those who are just joining once again, we do offer translation, and that can be found using the globe icon at the bottom of your screen. We have translation in French and Spanish, and so you can, if those are your stronger languages, then you can always make use of those interpretation options. So the presentations will be done in English. Additionally, please place your name and the organization you're representing and your email address in the chat, and we will be more than happy to share the link to the recording of the webinar, as well as other resources and presentations to you via email. All right, so on to our second presenter. So our second presenter is Dr. Kinan Aldamman, and he is a psychiatrist with significant experience in psychosocial support. He currently serves as a regional staff psychosocial support coordinator for Asia and the Pacific region of the ICRC. Kinan earned his PhD from Trinity College, Dublin in 2020, where he collaborated with the ICRC Psychosocial Center and the Sudanese Red Crescent Society in examining how organizational support influences the mental health of humanitarian volunteers. Prior to that, Kinan worked as the MHPSS coordinator for the Syrian Arab Red Crescent, where he utilized research-based methods to maximize the impact of psychosocial interventions. He contributed to multiple research projects in humanitarian and global mental settings. Kinan has a keen research interest in mental health in emergencies, organizational psychology, evaluation, theory-based approaches, and implementation science. All right, so I hand the floor over now to Dr. Kinan.
Thank you, Adrian. Thank you. Hello, everybody. Thank you so much for hosting me, for having me here. I want to share with you my insight about researching in the Red Crescent movement for the upcoming 15 minutes. So may I ask you just to give me a notification if you can see my slide? I hope so. All is good. Thank you so much for confirming. So I entitled my presentation with a crucial tool for efficiency, research for all of us as MHPSS practitioners, actually. And during my presentation, I will talk on why research is important for us in the MHPSS field. I will give 3 real-world examples from my work, actually, with different components of the Red Crescent movement on using research-inspired methods to ensure the impact on innovation in the methods while doing research in the humanitarian settings, and on influencing policies and practices by using research results. I will come also across some of the considerations for national societies and Red Crescent movement component, and I would be very happy to share with you some of the useful resources. So let me start by my first point. Why research is important for all of us as MHPSS practitioners. So maybe first allow me to ask all of us to some of these questions. If I ask you how can we strengthen our MHPSS workforce, or how can we effectively develop our MHPSS monitoring, evaluation, and research systems? What are the appropriate methods to assess the outcomes and the impact of our interventions? Or how can we better develop our supervision models to address the MHPSS needs in the humanitarian settings? Or finally, what is the added value of integrating or mainstreaming the MHPSS services into other sectors? I think maybe of you might share a similar stance as mine. Those are very relevant questions for all of us who work in the field of MHPSS. But what if I told you that those are actually the top prioritized research questions that resulted from a study, from a very recent study, actually? So research in MHPSS would be a great advantage for each and every practitioner, because these questions are in the favor of everybody in this group, I assume so. Beyond asking ourselves, does this intervention work, which research can answer very well, research can also guide us to know more about the need assessment. So what is the mental health status? What are the needs? What are the stress factors? What are the coping mechanisms of a population that we want to serve? Research can help us design appropriate mental health and psychosocial support intervention. And indeed, it can help us culturally and contextually adapting those to be more relevant. I would say also, more importantly, research help us implement our interventions better. So we can understand the barriers, the facilitators of implementing an intervention. We can account and incorporate the contextual factors while implementing, and that indeed will be in favor of making a greater impact. So here I see a very strong links with the previous webinars that I hope many of you have attended on cultural adaptation, on assessment, on monitoring and evaluation. Research is also a great component, echoing what Dr. Hamed was talking about, of doing no harm. And it contributes by this to the accountability to affected population that we all promise. And I would say final research can help us secure more fundings and make more systematic changes in favor of the mental health and well-being of communities we serve. So therefore, even though we all acknowledge that research requires significant resources, it remains a very efficient way to achieve favorable results. I'll provide 3 examples, as I said, from my personal experience within the Red Cross and Red Crescent movement. The example 1 is about using research-based method to adapt and implement MHPSS intervention. And this is not a research project per se, but rather it is a utilization of a systematic research-driven method to support the cultural adaptation and implementation of an intervention. And here I'm referring to the context adaptation of the Children Resilience Program by the Syrian Arab Red Crescent. I'm referring to a work that I conducted in 2016, actually. And the Children Resilience Program is a psychosocial support intervention designed for children affected by emergency and protection issues. So at the moment when we were thinking of implementing this intervention, we had documented the need for implementing structural psychosocial intervention in the Syrian conflict that goes beyond a recreational or a one-off approach for children affected by the war, actually. However, at that time, we had the challenges of the lack of experience in such intervention that was at that time within the Red Crescent Society, the difficulty in determining the effectiveness, but also the acceptance, the perceptions around those interventions, and the newness of the monitoring and evaluation principle amongst our volunteers who used to run the activities for children. So the solution came through and by research. What we did, we used the research methods, how they do that, how a research protocol of cultural adaptation. We used this to get a sequence of systematic way of adapting the intervention. We employed this systematic research-inspired steps that you can see on the slides in front of you to accommodate the culture, the language, and the context of the intervention. We've started by a very rough translation, and then we ended up with having comments by a technical team on what should be revised. And then we had a workshop to incorporate all these, and we worked very hard in documenting all the processes to end up with a piloting version. We tested the piloting version in 6 locations, in 3 locations, in 6 different, very diverse group of children, just to know if that intervention works, and also to have and to gain insight and feedback on whether we need to adopt something else. And then we ended up, after closely supervising the volunteers, and of course we had a lot of reports and documentation at that time, we ended up with having focus group discussions with the children, with their caregivers about the participations. We incorporated all the notes into a final version, and we finally managed to run a training of trainer in the Children Resilience Program. So to give you an insight on what has happened, in the slide in front of you, you see the pre-post evaluation tool. It's like a Likert scale. It is in Arabic, multiple questions, but as you can see, maybe the small icons or the pictures together with the numbers, and we've added those pictures to accommodate for the challenge of children who are unable to read. So we could never have reached this level of detailed adaptation without using the research. Actually, research-inspired methods really helped us adapt this intervention in a very good way. And as an evidence, I'm so proud to say that even these are recent pictures of implementing the Children Resilience Program in Syria, even after 8 or 9 years of that adaptation. In my second example, I want to touch base on how innovative the research methods could be in a humanitarian setting. I would like to say that really research paradigms are very diverse, and they go beyond the RCT, control, statistic, pre-post, control, whatever you want to say. There are many that we can use to account for the complexities of the humanitarian contexts that I assume many of us work in. So I'm referring here to the example of studying how what are the underlying mechanisms by which volunteer management influence on the volunteers' mental health and well-being. I did this research with the Sudanese Red Crescent Society, and I really would like to take the opportunity to express my deepest gratitude to the volunteers and the staff of the Sudanese Crescent Society. And I want to give them my deepest sympathies, because now there are a lot of actions of violence happening in Sudan. So at that time, I was using what we call it a realist evaluation methodology. It's a theory-driven one, by which we really test how, why, for whom, and in which context a program works to support or to generate outcomes. And the method realist evaluation data collection is based on, we call it teacher-learner interview style, by which a teacher, which at that time I was, should teach the recipients in the interview setting about their theories, and then the recipients should learn the theories and then teach them back to the researcher after refining them. So as you might maybe assume, the challenges were about, this is very difficult to grasp for non-academics. It might be boring to engage in conversations when we talk about theories, when theories are at the core. And it is challenging actually to synthesize the collective experience and insight of a large number of volunteers. So then the research, the innovation and research method happened. What I did at that time, I used vignettes as a theory teaching tool. And vignettes are short stories. So my initial theories, instead of teach them back in an abstract way to the volunteers, I wrote short stories, vignettes, exemplifying what those want to say. The stories used the volunteers themselves as their characters, and they were made, of course, contextually valid. Some of the questions then were added, you can see on the picture, to just generate and trigger the discussion after each vignette. And then those were utilized instead of in interview setting, in focus group discussion settings. So ultimately, the vignette serves as a very familiar way of engagement for all the volunteers, as many of them used similar approaches in trainings. And of course, it really helped us encouraging and inviting every volunteer to contribute in a free and safe way to the discussions. So this is another example to get more inspiration on using methods. It's beyond being very traditional. In my third example, I want to also show something about the power of research findings, how to influence action. And here I'm referring to my current job with the International Committee of the Red Cross, where we had in 2020 our staff mental health and well-being survey. At that time, our documented need was about understanding the mental health status of our employees and how that associates with our job psychosocial factors. However, we did have the challenges of how to determine the priorities of staff well-being by which we want to work, and how to mainstream the staff well-being consideration into a wider organizational and managerial aspects. So in order to account for all this, we did study the relationship by surveying 6,374 actually employees, representing the third of the the workforce of the ICRC at that time. We did study the mental health majors using validated scales, workplace majors using validated scales, and we really were able, using, of course, in collaboration with an external researcher in studying the relationship between these two indicators. In our results, we've been able to show that 40% of our staff were at risk of a mental health condition. And that was a very significant, actually, result. The other significant result was we were able to track these being at risk of mental health condition to the work-related risk factors, as you can see in slide of in the right in the slide up front of you, is like high work-life conflict, or low work engagement, or insecurity over employment, or low possibilities of deployment, and so on. So these are associated with this high percentage of colleagues who are, or employees who are at risk of mental health conditions. And that's by itself has triggered a great debate and interest within our organization. We've been able then to use the robust research finding to really catch the attention of our senior leaders, who assigned a working group to set priorities based on our results and based on other, of course, resources available in the organization. Once sub priorities were identified, then multiple focus group conducted with the staff members to map solutions, and then those solutions were all grouped together into one plan of action with clear timeline and indicators, leading the management to adopt these plans to improve staff well-being. So what I want to say that we could really never manage to do so without the robust findings of research. Research has a great weight. Just to maybe conclude from my three examples, I would like to echo what Dr. Hamed was referring to. So if you are in a national society or in other component of Red Cross and Red Crescent, and you might not have enough resources or expertise to engage in a research, I would really encourage you to partner with universities and academic institutions. And I know that we are very widespread, and I know that all and every person of you have somebody, a university or an institution next to them. So it might be a good idea to partner with those in order to do research project. It is a great one to use our regular data sources, referring to M&E, referring to need assessments, referring to maybe end of project reports, referring to evaluation. All these data could be used as a secondary data analysis in order to generate very relevant research findings. So maybe you might consider mobilizing those for research purposes. And the last one, I would really recommend using research findings to secure more funds, to secure more resources, to influence policies, to leverage what is there in place in favor of advancing your work. By the end, I would like to link you with some of the additional resources that I think they are very relevant if you are interested in developing your research skills as an MHPSS practitioner. We have this course, is a free course by the University of Geneva in collaboration with the ICRC, called Operational Research for Humanitarians. I really encourage you, if you want to know more about it, to sign up for it. It's free of charge for everybody. Thanks to my colleagues who will paste the resources in the chat box for all of you. The second one I would like to refer you to is the study of research, the most prioritized research questions in the humanitarian work that you might want to consider, and you might want even to question or to apply some of those into your research, your upcoming, hopefully, research project. The third one is about our work in my previous job on the lesson learned by doing research in organizational settings. And I think it might be a very good idea for you, if you are a researcher, to listen to others' experiences and to learn what you should accommodate and navigate through while doing your research. The fourth one is a very practical guide for humanitarians on how to do research. All the examples are in humanitarian language for humanitarian workers. And my last one is my thesis, which I'm encouraging you to read. It's an open access one if you want to learn more about my work with the volunteers in Sudan. So I also put some further readings for all of you. I hope those will be in the favor of inspiring you to do more research work. I would like to say really thank you very much for your attention. Thank you for giving me this opportunity. I apologize, maybe I'm a bit sleepy. It's very late. I'm calling from Bangkok. And let me give the special thanks to the technical group and the financial support of all the Red Cross, Red Crescent movement who contributed to the working group. Thank you so much.
All right, great. Thank you very much, Dr. Kinan. All right, so we will be jumping across once again to Dr. Hamed real quick for another presentation. He'll be presenting a case study from the Iranian Red Crescent. And in the meantime, we've noted your questions and we will take them shortly after Dr. Hamed's presentation. So without further ado, Dr. Hamed, the floor is yours once more. And afterwards, we will have a panel discussion. We will address all the questions that have been placed in the chat. So feel free to continue placing your questions in the chat and we will have them addressed shortly. Thank you.
Thank you so much, Adrian, and also Dr. Kinan, for your very nice presentation. And so I think we designed our two presentations to complete each other and transfer more information to audience. So in my second presentation, I will talk more about case studies that I worked and how I implemented and addressed social, cultural, and political considerations during research on MHPSS within the movement. So I will tell you an introduction of the country. So I came from Red Crescent Society in Iran. Iran is, so as you can see in the slide, is a diverse big country with a population of 83 million people in a very strategic place in the Middle East. The country is divided into 31 provinces that each with its unique culture and traditions, and has a complex social structure which is influenced by religion, ethnicity, regional affiliation, and also politics. So when I'm telling this story of the context, because when I want to say how we want and how we should consider social, cultural, political consideration, so we are talking about research in a country that has these factors. So researching within the movement on MHPSS in this country needs to considering these factors that's important for the country. And also Iranian Red Crescent Society is the major humanitarian organization, and by the law in Iran is the first organization that will respond to emergencies during earthquake, flood, and other human-made and natural hazards. And also Iranian Red Crescent Society is responsible for public preparedness. Because of these responsibilities, Iran IRCS has 8,000 staff and 2 million volunteers and rescuers. Also, IRCS plays a crucial role in supporting mental health and psychosocial support initiatives during emergencies, even during the pandemic and also other human-made and natural hazards, and collaborates with various stakeholders, including governmental and non-governmental organizations, to deliver MHPSS services effectively. So I conducted different studies in Iran on MHPSS within the movement. I was Deputy for Education and Research and the Dean of Applied Science University. So I tried to evaluate and monitor our MHPSS interventions evidence-based and scientifically with defining some research. For example, For example, investigation of correlation between exposure, trauma, and risky behaviors among first responders in Iran is one research that was conducted before globally. And also I was the lead of this project in Iran within the Red Crescent Society in Iran, and also some other emergency organizations. And for another project that I did mental health of first responders during the pandemic response by IRCS in Iran, and also another project working on the child protection in emergency and earthquake in Kermanshah and Iran. So at the first presentation, I told about how we should and how we can consider social, cultural, political considerations. So one of the secrets and one of the important things that I should say is crucial for conducting research on MHPSS is collaboration with other stakeholders. As I mentioned, we are not alone in the system. We are working together with other organizations. So I tried as someone I started working 10 years ago or 12 years ago as Deputy for Youth and Children in Red Crescent Society. I tried at that time to expand my network with different governmental and non-governmental organizations. And during my collaboration and during my responsibilities in the IRCS, I tried to, and still I'm trying to be in touch with these stakeholders, such as, for example, in the provincial level, I try to collaborate with province governor and crisis management organization, Ministry of Health in the ministerial level and in the national, in the provincial level, Ministry of Education for schools and universities, and also, so I try to collaborate with them and make a network collaborating with them. So this collaboration, I tried also to invite them to formally research questions together. And then data collection. So I went to different offices of these officials, different organizations. I told, I want to research on this topic. It is important because it will be important for our society in Iran. It's first responders, because we should respond in the time of emergency. And if we fail in this mission, all of us, we are in the same ship, and people will blame all of us. So if we want to do a good research to provide evidence-based data and results for better response, I need your help. So I try to define research questions with them, and also receive some funds and resources from those organizations. I ask universities for hiring researchers or engaging their professors and their researchers to collaboration. I asked and requested some resources from political parties to collaborate together and conduct research. And I ensured also compliance with internal security rules, because when an emergency happening in a country, usually countries look at this as a security also problem. They securitize everything. So I try to ensure then that these researchers and these data will not harm to the government or to any any elements of the government. So this collaboration, this conversation, and creating a channel, that I created this channel with these people, I tried to give them enough information to ensure them that these data will not use against them. So I think these political considerations during research, I did that and I was successful. So after conducting research and engaging these politicians in research without giving them some additional data, after finishing the research, they helped me also in conducting and implementing the results of the study. For example, I found that there is a gap on gender and diversity. When I came back from a workshop that was conducted by PS Center, I found that there is a gap in training gender and diversity to our volunteers and staff in IRCS and also other organizations. I did research, I found gaps, and I tried to be in touch with some policymakers in the national level and also some members of parliament. I talked with them during 2 years, and after 2 years, I was successful to include this discourse of gender and diversity in emergencies in all training textbooks of volunteers and staff of IRCS and other emergency organizations. So so it is not only doing a research. After that, also we should follow our to implementing our results in the national and local level to see the fruits of our research and to see that how we can successful and guarantee our work. Also, the cultural considerations is important. For example, in Iran, working with female and male sometimes is sensitive because it's a Muslim country. So it's not possible, for example, data collection by men about women or vice versa. And this is a very sensitive topic. So I try to, and also different provinces, for example, Arab in Khuzestan or Kurds or Baluch or Pashtun or Turkmen in North, in different types, in different regions of the country. I try to contact with my local people and local friends in different provinces and local colleagues in Red Crescent Society branches in different provinces and ask them about how much these topics are sensitive in their provinces and then conducting the research in national level. So I try to be in touch with local people, asking them to collaborate with me, asking them and requesting them to help me in data collection in their province. And I didn't go directly to that province to research, or I didn't send people from my organization to that province. I asked local people to help me in data collection and then also interpretation of data. So, and also talking with different people about these sensitive issues. I saw in the questions that that was written in the chat about how we consider these religious issues in our research. So I will answer to this question in the Q&A and not here because I also don't have so much time. So if I want to talk about the lesson learned and recommendations, working closely with government organizations is very important, and also adapting research methods to align with cultural, social, and political factors is very important. If you have also question about how we can adapt research methods to these factors, also I can answer to you after this presentation. In conclusion, the importance of considering cultural, social, and political aspects is very important, and adapting to local context and ensure successful research project, I think, will be secret is collaborating with local partners. Thank you so much for all organizers of this webinar.
Thank you so much, Dr. Seddighi and Dr. Aldamman. We do have some questions in the chat. You already referred to them, Hamed. We're starting the panel discussion now, and I'm just getting back to you with the two questions that you mentioned already. So how do you, or can you share examples then of research, including religious actors working on MHPSS efforts? And I'm passing to you, Hamed.
Yeah, thank you so much for this question. So as I mentioned, a stakeholder analysis is very important, and sometimes some group that their numbers is not so many, maybe they have more weight. For example, religious leaders, their number is not so many in a community. Maybe so in one city, one religious leader is very important. Between, for example, a city, the population is 300,000 population, and there is one religious leader that's very important. So I try to, so for example, for these religious leaders, was very important to not mixing, for example, girls and boys, for example, for our MHPSS interventions, to not working together. And so I tried, for example, in our research that I should have different diversity in our group, research group, from men and women volunteers in our group. First, I tried to talk with religious leaders that what is my intention from this research and how this research can help to the society and how can improve the well-being of people. And then I was clear and I was transparent about my work. And I talked with them and communicated. And then he said, okay, that's a good idea and no problem if you go and continue your work. So this is a lesson learned. I earned it from before, because once, I think it was 8 years ago, I worked in a city and I didn't consider these cultural considerations in one city that I didn't know, I didn't work before on that city. And after conducting that program, they called me and they told me, okay, you did that, and it is against our culture in this city, and why you did that. And so I, after some explanation, 2 weeks conversation, finally that problem was solved. But I learned that I shouldn't ignore anything in a culture, and I speak with everyone and know first who is important more in different cultures and different political contexts. So and another thing, this is about the consideration of political, and the second thing, they can help us, especially because religious leaders sometimes they are influencers in between some people. So I try to use them and to request their help in sending our messages from our results for better mental health well-being of people after emergencies. Thank you.
All right, thank you, Dr. Kinan. I'm sorry, Dr. Hamed. Dr. Kinan, over to you. Could you share examples of research including religious actors? Well, the same
Actually,
question applies, sorry. Yes,
thank you, Adrian. I would just say, Dr. Hamed, you're expert here. I haven't conducted my research with faith leaders, but I've worked with them as part of the cultural and social considerations of the psychosocial interventions. And I agree with all what you've said, Dr. Hamed. I think they are part of the community leaders. They are part of the gatekeeper, and maybe they are the main gatekeeper of a society or a community. But we know all that religiosity, being or having a faith, is also a very important resource for people to balance, and particularly in a humanitarian context. So I haven't conducted research here, but when we talk about the 5 principles of hopeful, for instance, I would say that he always refers to religiosity, and he maybe is also want to say maybe religiosity is the 6th pillar here, is the 6th element that we need to emphasize. We need more research on as a human phenomenon that exists, I think, more than 95% among human across cultures. But I'm so sorry, I don't have a particular experience in here, so I would not give my personal examples. Thank you so much.
Okay, not a problem. All right, so another question from Mavis in the chat is, in my experience, research efforts across humanitarian players has been rather fragmented. How do you think we can increase research collaborations amongst various humanitarian players working within the same communities? Question to both of you, so I don't know which of you would like to go first.
That's an excellent question. I don't mind take it first, and Dr. Hamed, you have more experience in this field than me. That's a very excellent question, because this gap doesn't only correspond to research. I would say it corresponds to the humanitarian response in general. We've seen a lot of harm coming because we don't coordinate our efforts together. I think the mechanisms of coordination in the humanitarian sectors, the sectorial one, the MHPSS, protection, child protection, SGBV can serve a very good tool if we want to accommodate for this. But I don't think it is an inclusive tool. It is not that comprehensive and well established. So when we do research, what helps us, for instance, usually when you do a secondary, a systematic review, you register this, and then there are platforms where you register your research, you register what you are doing, what you are trying to do, and then nobody else will take over and to replicate your research and to waste the resources. But in a humanitarian setting, whether there is such a hub for this, I'm not aware of. I think now the PS Center, for instance, and the movement, they have the research working group in MHPSS, where there are a lot of coordination efforts in updating the researchers across the globe on the research on MHPSS. I think this is a very promising initiative. And I think the working group that we are now contributing to the work will serve in this. I hope so. This is maybe my dreams about it, but I think that's a very excellent point for further improvement in the future. Over to you, Dr. Hamed.
Thank you so much, Dr. Kinan. So in my experience, as you mentioned also, it's a very good question. And in my experience, I think it's not easy, but I try to make this a strong collaboration between different stakeholders and humanitarian actors in the same community. And so usually different stakeholders in one community, they are competitors. They compete each other to receive more fund, more resource, and show themselves more stronger than others. And their logo is very important. And I knew that. So I told them, so it was there were some meetings between us, and I told them, okay, we can collaborate together. And the thing that is not important for me is my logo. The logo of Red Crescent Society in Iran and the RCS is not important for me. I provide so we can collaborate together, and I will give you my draft. I will give you the draft of my research to you, and you can use for yourself, for your organization. You can put your arm, no problem. You can use it in media, whatever you want to do. And they were really happy, because maybe some of them, they didn't have any resource for research or didn't know how they want to do that, but they were very happy. And I was also happy because I wanted to conduct a research and I was successful. So, and some of them still, we are good friends together, even they are not the head of that organization in the community. We are good friends together. We published articles, so we publish our findings together. We went together so whenever we want to go to show that how much our work was important, for example, to the governor, we were calling each other, okay, we are going. So we were, for example, 4 or 5 humanitarian organizations in the community, and always we were calling each other, okay, we are going there and we want to talk and we want to receive some fund and resource. Let's go together. So I think the secret of that is creating a good communication channel between each other, showing that you are eager to do that, not sticking to and don't show that only your logo is important. Be free, be open for all, and share resources generously with other organizations, and they will do that also with you. Then we are talking about different organizations. We are talking about different people that represent those organizations. If I'm going in representation of IRCS in a meeting, they know the organization with me, how I behave with others. So if I show myself as a generous person that is eager to collaboration, they will say IRCS is a very good, generous organization. So this is the stories of people and individuals. Thank you.
Great. Thank you very much for the feedback, gentlemen. All right, so we have another question for Dr. Hamed. Could you share examples of ethical dilemmas and how you solved them in the past?
Yeah, thank you. Some ethical dilemma. I worked on a research that risky behavior amongst first responders of IRCS, and in between those questionnaires, we asked some sensitive questions. For example, have you ever used drug, or have you ever informal sex with, for example, not with your partner or other people? And there were some sensitive questions, and I knew that if I collect this data, and later if maybe someone else have access to this data, maybe it will be very dangerous, because these questions have some risky consequences for the participants. And especially because we talked with first responders in different provinces, and their numbers were not so high that maybe I can hide them between participants. There were maybe around 130 people. It wasn't an easy decision, but I talked with the group of research, and I prefer to not include 2 or 3 questions that may be penalties for this question, and answer to this question will be so high. Even it was possible to collect those data, but I decided, it was a dilemma. I decided to not include those data because I know that I couldn't protect those data well, or at least after myself, I cannot protect those data. So this is one of the ethical dilemma that I was faced with that, and I try to protect participants instead of doing my research.
Yeah, understood. All right, so thanks there from the person in the chat who had posted the question. All right, so questions to both of you once again. All right, how do you think the cultural, social, and political considerations presented in your case study can be applied to other contexts, specifically when conducting MHPSS research in diverse regions across the world? Want me to repeat the question?
No, I
Okay, no
I
problem.
can go for
All
first for this question, and then Dr. Kinan can prepare himself for this question. I know that he is prepared, but because I'm warm enough first that speaking now, I can go for this. I think these are only some examples of my case of considering social, political, cultural considerations for research. But other contexts with changing maybe and considering the system of their country, their national society or their component, they can use these examples for collaboration with other stakeholders, knowing their, because the process is the same. You should do a participatory method, collaborate from the first point of research, formulating your question to the discussion about results. You should have a participatory method, and also engaging with the stakeholders, inviting other people to your work, and dissemination of your information. This is all of the processes are same. Only you should bring the characteristics of your context to this formula and conduct your research. So I think that is not so much difficult for using this template for doing your research. Thanks.
And if you allow me, yeah, I would like just to add, I think this is a very important question as well, because usually when we do research, particularly on intervention or impact, we do it for the sake of, we need to control all the other factors in order to know that this intervention works. And this effect is due to attending counseling sessions or to attending this specific intervention, which we learned about from the control environment and social science research. But I would say it's not that up to date. The current models, there are a lot of good and recent trends that we talk about transferability of the interventions, the knowledge, the theories, the assumptions. So these assumptions that we can transfer from one context to the other by, first of all, knowing the contextual factors that can trigger the change. And second, by thinking, instead of being very focused and very, linking between two people attended this intervention and that intervention worked with them, or this intervention worked for everybody in this society, just going beyond or in between these two paradigms. Instead of saying this intervention works only for a person, which is X, Y, or Z, or this intervention works for everybody, I might phrase my actually questions about for whom this intervention works, in what context, what are the socio-political elements that I need to encounter for while implementing it. So give you a clear example, for instance, when we were adopting the Children Resilience Program in Syria, where I had an example from, there are a lot of things about armed group. Army is doing this, people with guns and whatever. And at that context, it was so sensitive. It was very sensitive because we have a polarized society with people who support maybe the governmental ones, people who support the non-governmental ones, and then the same ones exist in the same societies. So how to account with this? And we've decided to have terminologies that can be used for everyone without any sensitive, neutral terminologies, that children were able to understand well what we mean by that, without taking their previous judgmental stance. A simpler example, I would like to say, if I tell all of us that I went to a coffee shop, I would say all of you would say a coffee shop is a place where you have coffee in cups and chairs to sit or a place to sit. But can you imagine the differences in the coffee shop principle between Yemen and New York, for instance? I think many of you have pictures on this. This is exactly how we transfer our knowledge. There are core elements of the coffee shop that are still transferable between Yemen and United States, but the other elements are different. I would say focusing on what is transferable should be our focus in order to advance our research impact. Thank you so much.
All right, thank you very much for the feedback. Okay, great. Once again, an open question to both of you presenters. In your experience, what are some of the most effective strategies for addressing cultural and social sensitivities when conducting MHPSS research in emergency situations, and how can researchers ensure that they are being culturally sensitive and respectful throughout the research process? All right, once again, in your experience, what are some of the most effective strategies for addressing cultural and social sensitivities when conducting research in emergency situations? And how can we as researchers ensure that we are being culturally sensitive and respectful throughout the whole process?
So if I want to go first for this question, I try to do a context analysis first. So in the context analysis, I will find some important information about social, cultural, political situation in the context. And also, as I mentioned before, a stakeholder analysis to know how many organizations are working in that environment. So when I know the context and I know the stakeholders, then I can design a good research. For instance, now I'm working on psychological impacts of a smaller scale continuous emergencies on children. And my context is three countries, including Netherlands, Iran, and Iceland. So these are three different countries with different cultures and political socioeconomic situation. But the theme of research is same. So first, I know before the Iran context, but now in the Netherlands, I'm trying to do a context analysis. What is the culture of people? For example, people here, maybe they don't want so much to complain about the situation. So it's not easy to find some answers from them. For example, it's one of this, or some other cultural norms here in the Netherlands. So context analysis, doing this research is important and vital for my research. The second one is stakeholders. How many stakeholders are working on research on mental health here in this country? In this city of Groningen, there are some unnatural and gas-induced earthquakes in this city. So in the last 10 years, this is a continuous earthquakes in the city. And after knowing the stakeholders and other organizations are working on this research and also on the interventions on MHPSS, then I can design my qualitative and quantitative surveys and interviews and focus groups enough, because now I know enough about, at least enough, I mean enough for conducting research. And during the research also I will know more. And also in the Iceland country. So as you mentioned, it's not easy to find these social, cultural, political considerations at the first, but I think there is need a pre-research before starting your research, a pilot study or something, and then you can conduct your main study, especially in those contexts that it's not your expertise or it's not your community. Thank you.
May I just add, I agree, Dr. Hamed, and I want to give you another good example from my work in Sudan with the Sudan Red Crescent volunteers. So I'm a native Arabic speaker, and they are native Arabic speakers. However, I've taken 2 or 3 months reading about Sudan and understanding the culture. I have a cultural advisor, a friend, a Sudanese friend, who I was referring to her with everything in terms of the culture. I did once visit to the field only to explore what does it mean. And before even starting my data collection, I was for 2 weeks with the volunteers, experiencing the social activities that they do, participating in those activities, asking them very particular questions about it. And that helped me formalizing a very good idea about what can be asked and what cannot be asked, but also help them also to feel that there are no imbalances between me as a researcher who is coming from maybe a foreign country, a different country, with a hat that has a lot of things on it, and them as volunteers in a very remote area who are starting their work. So I think that was a very good one I used, and it was very helpful. I would say even understanding the culture sometimes goes beyond what is accepted and what is not accepted into the common sense of dealing with things. So the norms about how would we say or talk about grief, for instance, and how would we express our anger. In many of the cultures, people don't confront, for instance. People rather keep it for themselves and gossip. In collectivist culture, for instance, people talk about, or people will not reach out to their family members that much when they are in distress because they don't want to bother them. Rather, they prefer to go to more outsider friends and so on. Is a very opposite one if we study a Western context where people are more direct and they will really rely and they will be frank in front of their family members actually. So I would say it's a very important one to study the culture, but it's a very important one to have this informal exposure and to use some points, people, reference to make sure that we are doing our best. We will never capture everything. A research project is a small glance of a whole reality, and that's it. There is no research that can capture the whole reality, but it's a very good way to be closer and closer to this whole picture. Thank you so much.
All right, excellent responses from you both. Not seeing any other questions in the chat right now, so Monia, I'll hand it over to you again to do the wrap up and so on. Over to you.
Thank you, Adrian. Yes, what a very rich and substantial webinar to close this series of 4 webinars. Thank you so much, Adrian, for hosting us. Now, while we'll be wrapping up and take the opportunity to have a quick recap of what was said, I would like to ask you to answer 3 poll questions that will pop up on your screen now. This will really help us evaluate if this information was helpful to you for your work. Now, what have we heard today? Now, from the case studies from Iran and the ICRC, I think we impressively learned why it is so important to bridge this gap between our work as practitioners and research, while acknowledging that there are resources involved with research, of course. But from these 2 examples, we really learned about the power of research. It was very interesting for me also to see how implementational research can go beyond the traditional academic research with controlled environments, and that it can, in fact, really accommodate the full complexity and emerging nature of humanitarian work. And how impressive it was to see also how research can help MHPSS practitioners not only in measuring the impact of their work, but as both of the presenters have shown and mentioned, is that it can also help us exploring the needs better of the targeted populations. It can help us designing and adapting our interventions and thus also improve the implementation. We've heard how important it is to partnership, to have partners like universities making use of regular data that is already available, like our M&E data that is already there, and using also research findings to secure funds, which is relevant for all of us, and also influence policies. This has been really proven to be a good way forward for national societies in the ICRC movement. I think we've been introduced also to so many helpful resources and tools in this webinar. We will also provide you these resources through the website of the PS Center. You'll find the link in the chat where we will share the recordings of this webinar and also all the other resources you'll find there again. Now, what remains for me to do is to thank everybody involved in this webinar. A big thank you to you, Dr. Hamed, who has organized this webinar behind the scenes, who has introduced us to the topic of tonight's webinar, and also for sharing your case study of the Iranian Red Crescent with us, which was really very interesting. And also to you, Dr. Kinan, for letting us learn from your very rich experiences with MHPSS Research in the movement. It was so interesting. Thanks to you, Adrian, again, for hosting us, for taking us through this webinar. And not to forget our 4 interpreters behind the scenes. Thanks for helping us with the translations. And last but not least, to Natalie and Veronica from the PS Center, who for all the technical support, for all the videos that they did for us. Without all of you, this webinar series wouldn't have been possible. So last but not least, if you would like to get involved in this initiative, the MHPSS Roadmap with us, we really invite you to become part of our working group. Feel free to contact Sarah Kate or me in this case. You will find our email addresses in the chat just now or on the flyer. Thank you, Sarah, for sharing our email addresses, or on the flyer of this webinar series. Now, I wish you all a very nice rest of the day and hope to see you in some other contexts again. Thanks. Bye, everyone.
Thank you, everyone.
Thank you, everyone. Take care.
Thank you, everyone.
Thanks.
Thank you, everyone. Appreciate. Bye.
Who's just
We'll just wait for a minute. Can you stay in here for the recap and the briefing thing?
Hey, Adrian. Staff interpretation, Michael.
Okay, it's just us now. Wow, we've done it. Congratulations. This was so good.
Great,
How was it
congratulations.
for you? Was it okay, Hamed? You were very flexible tonight. Thank you.
Thank you all. Thank you so much. Yeah, it was great for me. And also, I think this order was better. Me first, Kinan, and then again my case study. So yeah, I enjoyed a lot. Thanks. And thank you all for all of organizing this behind the scene, front of scene. Thanks.
Thank you all. Thank you, Dr. Hamed, for just remembering my name and calling me for this. I couldn't resist. It's 10 p.m. I'm still in the office, huh? I'm very sleepy, so it's the REM sleep movement things coming in my head, but I really enjoy it.
No,
And I
it
think the
was amazing.
The questions, the level, I would just say, like, why we don't have a lot of people? It's global, so we need more people being
everyone.
Yeah.
Yeah, but thank you so much for.
But I think for a webinar, I think this number was good because around today it was 80 people, and we cannot manage maybe more. And yeah, I think if it was maybe 200, I think it wasn't easy to manage even about this internet and server and everything. Maybe later you, as in the morning session was mentioned, that you can, and both of us, we can work on something to translate our information, disseminate our information, our research with others. So
definitely, we would definitely get back to you with that a little bit later in the year or early next year. We would really like to look for a way to disseminate all this information in a way that it stays accessible for the national societies, because this is so important and so rich. So definitely we will allow ourselves to get back to you. Thank you so much again, really.
Thank you so much. Yeah,
And thank you.
Getting to know you guys.
Yeah. And for staying up for so long, I wish you a very good sleep now and a good rest. I hope you don't have to get up very early tomorrow.
Thank you so much, everyone. My best greetings, regards, and hugs to the colleagues in the PS Center. I miss them so much. Please let them know. And Dr. Hamed will be in touch, of course. Adrian, thank you so very much. Thank you. And it was lovely to meet you. Bye-bye all.
Yeah.
Bye,
Bye-bye.
everyone.
Bye, Kinan, and thank you
Bye.
again. And
All right,
bye,
everyone.
everyone.
Take care. Sorry.
Bye, Adrian.
Bye. Bye.
Bye.
Looking forward to seeing you in Copenhagen in September. Bye-bye.